How to clear a sinus infection. Your sinuses are cavities in your forehead and face that serve various functions, including moistening the air you breathe and producing mucus to help trap and expel pathogens from your body. Sometimes, the sinuses can't fight off the pathogens, leading to the familiar symptoms of a sinus infection: inflamed and swollen sinuses, increased mucus, headache, cough, congestion, and sometimes fever. Depending on the cause of your sinus infection, there are different ways to treat it. Sinusitis, inflammation of the sinuses, will usually clear up on its own, but you can help speed the process and reduce your symptoms with some at-home care. Determining the type of infection. Recognize the basic symptoms. Sinusitis generally presents itself with the same basic symptoms. Symptoms of acute sinusitis often worsen after 5-7 days. Symptoms of chronic sinusitis may be milder, but are more long-lasting. 2. Headache. Pressure or tenderness around the eyes. Nasal congestion. Runny nose. Sore throat and post-nasal drip, the sensation of dripping or running mucus at the back of your throat. 3. Fatigue. Cough. Bad breath. Fever. Consider how long you have had symptoms. Sinusitis can be acute, lasting less than 4 weeks, or chronic, lasting longer than 12 weeks. 4. Having symptoms for a long time does not necessarily mean your sinusitis is more severe or dangerous. Acute sinusitis can be caused by many things, but viral infection is the most common cause, 90 to 98% of cases. 5. You may get acute sinusitis after having a cold. Acute sinusitis due to a viral infection will usually improve within 7-14 days. Allergies are the most common cause of chronic sinusitis. You may also be more susceptible to chronic sinusitis if you have asthma, nasal polyps, or if you smoke. Check for a fever. Allergic sinusitis usually is not associated with a fever. Sinusitis caused by an infection, such as the common cold, may present with a fever. 6. A high fever, over 102 F, is often a sign of bacterial sinus infection. If you have a fever above 102 F, consult with your doctor. Look for dark yellow or green mucus. Dark yellow or green mucus with a bad smell or taste may be a sign of bacterial sinus infection. If you think you have a bacterial sinus infection, consult with your doctor. He may prescribe an antibiotic such as amoxicillin, augmentin, cefdinir, or azithromycin. 7. Physicians will often wait for further observation before prescribing an antibiotic. Many cases of bacterial sinusitis improve without antibiotic treatment. Doctors try to avoid prescribing antibiotics unless truly necessary, because too much antibiotic use can increase your risk of developing an antibiotic-resistant infection. 8. Antibiotics will only help to treat bacterial sinusitis. They will not help other types of sinus infection. Only 2 to 10% of acute sinusitis is caused by bacterial infection. 9. Know when to see a doctor. In addition to high fever and dark yellow or green mucus, there are other symptoms that signal you should see a doctor. A doctor will evaluate you and determine whether a bacterial infection is likely and whether antibiotics are needed. If you have any of the following symptoms, consult with your physician to determine what treatment she recommends. Symptoms that last longer than 7-10 days. Symptoms such as headache that do not respond to over-the-counter medications. 10. Productive cough with dark yellow, green, or bloody mucus. Shortness of breath, heaviness of your chest, or chest pain. Stiff neck or severe neck pain. Ear pain. Vision changes, redness, or swelling around the eyes. Development of an allergic reaction to any medication. Symptoms may include hives, swelling of the lips or face, and/or shortness of breath. Worsening of asthma symptoms in individuals with asthma. If you have been suffering from chronic sinusitis, it's a good idea to see a doctor. He can help you treat long-term sinusitis. He may also refer you to an allergist or otolaryngologist, ear-nose-throat doctor, to help determine the possible causes. Treating symptoms with medication. Consult a doctor. If you are going to take a prescription medication, you will obviously need to see a doctor first. However, you may need to call your doctor before taking a non-prescription medication in some cases as well, especially if you have medical conditions or take other medications. While many over-the-counter medicines are safe for healthy adults, there are many circumstances which would complicate self-treatment with OTC medicines. Never give medication to children that is meant for an adult, as many cold medicines are not recommended for children. Women who are pregnant are likewise restricted from many cold medicines, and nursing mothers may need to check with a care provider or lactation consultant before taking OTC medications. Use antibiotics as directed. If your physician prescribes antibiotics for a bacterial sinus infection, be sure that you take the entire course of antibiotics, even after you begin to feel better. This will minimize the possibility of the infection to return or become resistant to the antibiotic. Antibiotics commonly used for bacterial sinus infections include amoxicillin, most commonly, Augmentin, Cefdinir, or azithromycin, for individuals who may be allergic to amoxicillin. 11. Side effects common to these antibiotics include nausea, vomiting, diarrhea, and a skin rash. More serious side effects such as fainting, trouble breathing, or hives should be reported to your doctor right away. 12. Take an antihistamine for allergies. If your sinus problems are associated with seasonal or systemic allergies, antihistamines may help. Antihistamines are medications that directly work against your body's reaction to allergens by preventing histamine from attaching to receptors in your cells. Antihistamines can stop the symptoms of allergic sinusitis before they start. 13. Antihistamines generally come in pill form, such as loratadine, Claritin, diphenhydramine, Benadryl, and cetirizine, Zyrtec. Liquid, chewable, and dissolvable forms may also be available, particularly for children. Consult with your doctor or pharmacist to determine which antihistamine will be most effective for you. Do not take an antihistamine for acute sinusitis without consulting with your doctor. Antihistamines may complicate acute sinusitis by thickening your nasal secretions. 14. Take an OTC pain reliever. Pain relievers will not cure a sinus infection, but they can reduce some of the unpleasant symptoms associated with it, like headaches and sinus pain. 15. Acetaminophen, paracetamol, Tylenol, or ibuprofen, Advil, help relieve pain from headaches, sore throat, and can reduce fever. Be mindful that ibuprofen should not be given to children under 6 months of age. Try a nasal spray. An over-the-counter nasal spray may provide some immediate relief to blocked sinuses. There are 3 main types of nasal sprays: saline sprays, decongestant sprays, and steroid sprays. Decongestant sprays such as Afrin should not be used for more than 3-5 days, as doing so can actually worsen your congestion. 16. Saline sprays can safely be used frequently and help clear out mucus. Fluticasone, Flonase, is a steroid nasal spray that is used to treat symptoms of allergies. This type of nasal spray can be used longer than decongestant sprays, but may not help with sinus infections, as it is meant to help with allergy symptoms. Try a decongestant. These medications can help relieve stuffy noses and sinus pain. Do not take a decongestant for more than 3 days. Using a decongestant for too long can cause rebound congestion. 17. Common choices include phenylephrine, Sudafed, or pseudoephedrine, Sudafed 12-hour. Some antihistamines include a decongestant, such as Allegra D, Claritin D, or Zyrtec D. Many medicines marked as D contain pseudoephedrine and may be held behind the pharmacy counter due to purchasing restrictions. Some decongestants contain acetaminophen. Do not take additional acetaminophen if you are taking a decongestant that already contains it. Overdose can cause serious complications. 18. Consider a mucolytic. A mucolytic, such as guaifenesin, Mucinex, thins mucus secretions, which may help improve drainage from your sinuses. 19. There is not strong evidence that these help treat sinusitis, but you may have success with the medication.